This video is on Addison's disease. In Addison disease is a primary adrenal cortical insufficiency. It is rare but it can be fatal. In Addison's disease, there is destruction of the cortex of the adrenal glands, which leads to deficiency in cortisol and also aldosterone, which are the glucocorticoids and mineralocorticoids. These are the few causes of Addison's disease. The most common cause is autoimmune adrenalitis. Other causes include tuberculosis, adrenal metastasis from cancer from other parts of the body, lymphoma, opportunistic infections in AIDS, adrenal hemorrhage, and also congenital causes like congenital adrenal hyperplasia. For clinical features of Addison's disease, the patient might complain of symptoms like loss of weight and appetite, fatigue, and also dizziness, which can also cause syncopal attack. They may complain of weakness and gastrointestinal disturbance like nausea and vomiting, diarrhea, abdominal pain, and others. Depression and psychosis are also among the symptoms, and Addisonian crisis, which I will talk about it more later on. So in all patients who have unexplained abdominal pain or vomiting, we have to think of Addison's disease, as this condition can be fatal if not treated. For signs of Addison's disease, the patient might have hyperpigmentation, especially at the palmar crease and also the buccal mucosa, and postural hypotension. To investigate for Addison's disease, we can do full blood count, blood urea and serum electrolytes, the BUS, and also check the glucose level. For full blood count, we can do together with differential count, where we expect to see eosinophilia and also anemia. For BUS, expect to see low sodium level and high potassium level due to reduce in the mineralocorticoids. Whereas the glucose is expected to be low due to low cortisol level. Other investigation we can do is the short ACTH stimulation test, where we do plasma cortisol before and 30 minutes after giving synectin. Addison's disease is excluded if the 30-minute cortisol is more than 550 and more per liter. Other investigation include ACTH. In Addison's disease, the ACTH level in the morning is high, whereas it is low if it is due to secondary causes. Addison's disease is primary cause of adrenal cortical insufficiency. We can also do 21 hydroxylex adrenal autoantibodies testing. It will be positive if it is in autoimmune disease. This is to check the cause of Addison's disease, for example, autoimmune adrenalitis, which is the most common cause. We can do plasma renin and aldosterone to assess the mineralocorticoid status. Whereas for imaging investigation, we can do abdominal X-ray or chest X-ray to look for any signs of previous tuberculosis, for example, upper zone fibrosis, and also for abdomen, we can check for any adrenal calcifications. Moving on to treatment of Addison's disease, we can replace the steroids by giving hydrocortisone, and also give mineralocorticoids like fludrocortisone to correct the postural hypotension, hyponatremia, and hyperkalemia. Patient education is very important. We have to warn them against stopping their steroid medications abruptly. We also have to give a steroid card and advise them to wear a bracelet showing that they are on steroids. This is important to emphasize that the prescribing doctors, dentists, or surgeons, they must know that the patient is on steroid use. And before any strenuous activity or exercise, can add on hydrocortisone to daily intake. Double up the steroids in febrile illness, injury, or stress, and also can teach the patient, show them how to inject the hydrocortisone if the vomiting prevents their oral intake. To follow up on patients with Addison's disease, we do yearly follow-up by checking the blood pressure and also the urea levels and electrolytes. We also watch out for autoimmune diseases, for example, pernicious anemia. Now let's talk a bit on Addisonian crisis. Addisonian crisis is an acute adrenal cortical failure which is characterized by signs and symptoms like nausea and vomiting, hypotension, and also shock. If the patient is unknown to have Addison disease, some of the triggers that could cause this Addisonian crisis are infection, trauma, any burns, or surgery done. To investigate, we can do full blood count, urea electrolyte and creatinine levels, cortisol levels, and ACTH. To treat Addisonian crisis, we have to give IV hydrocortisone, IV fluid resuscitation, correct the hypoglycemia by giving intravenous glucose. We treat the precipitating cause, and we can start giving mineralocorticoid therapy like fludrocortisone if the cause is due to adrenal origin. And then later on, we have to refer the patient to endocrinology for further management. That's all for this video. Thank you.